Hi, I'm Vijay Chopra. I'm the founding president of Heart Failure Association of India and currently working in New Delhi in a hospital as director of the heart failure program and research. So I'm leading a special focus session on aldosterone and its implications. And why is it important? We know that aldosterone is a key component of renin-angiotensin-aldosterone system, which plays a key part in the pathogenesis and perpetuation of heart failure. So this issue is important because we know that renin-angiotensin-aldosterone system plays a key part in the perpetuation of heart failure. And therefore, we had ACE inhibitors, ARB and ARNI, which deal with one part of it. We have beta blockers, which deal with sympathetic overactivation. And third part is aldosterone antagonists. For some reason, aldosterone antagonists have not been used as much as the other classes of drugs. And I think that is mainly because of the fear of hyperkalaemia and worsening of renal function. And this is more so in patients with diabetes and those who have renal failure. Paradoxically, these are the patients who are likely to benefit the most with these drugs. And therefore, this special edition is divided into 4 parts. First one talks about aldosterone and its importance. Second one deals with aldosterone receptor antagonists. And there's a special focus on the new agent finerenone because that has got advantages over the traditionally available aldosterone antagonist drugs like spironolactone and eplerenone. The third issue talks about hyperkalaemia, which is a bugbear in the management of heart failure with this class of agents, and what are the best strategies to deal with it. And the fourth issue talks about aldosterone synthase inhibitors because these work more upstream and they are likely to have a better effect and more complete aldosterone antagonism. So these are the 4 issues which are part of this particular collection. It's extremely important that the physicians recognize the importance of aldosterone antagonism and they use these agents a little bit more. And their strategies to deal with the perceived risk of hyperkalemia, because these are the group of agents which give a great deal of benefit, not only in management of heart failure, but also in reduction of sudden cardiac death and reducing cardiac fibrosis, which is an important part. So I think understanding these mechanisms will help physicians become more confident in using these agents to treat their heart failure patients. So I think there's a lot of focus in this meeting on the newer class of agents which are coming up, like aldosterone synthase inhibitors. And at present, they are not in the guidelines. But the other aspects of it, what I have discussed, they are entirely in line with the guidelines, and the guidelines recognize the importance of aldosterone inhibition. And although finerenone at present is not in the guidelines right now, but it is entirely possible that with the new data which has come up, is going to be given either a class 2 indication in very near future. Now, as far as aldosterone synthase inhibitors are concerned, there's a lot of work which is going on, and there's a lot of data which has been presented in this particular meeting. These trials are ongoing and they're likely to yield their results in the next 2 or 3 years. So we'll see what happens with that.